nature, normally approved by AHA meetings, will be approved by one vote unless any trustee desires to have a separate vote on any or all of the items. The consent agenda consists of discussions, considerations, and actions on the following items. A, the minutes of the regular trustee meeting, September 23rd, 2025. B, the finance committee meeting minutes, October 28th, 2025. And C, the check report, September 9th, 2025 to October 8th, 2025. Do I have a motion to approve the consent agenda?
Second.
Thank you. I have a motion by Dr. Brown, a second by Dr. Simon to approve the consent agenda items A through C. Roll call?
Martin?
Yes.
Bowman?
Yes.
Burke?
Yes.
Simon?
Yes.
Brown?
Yes.
Hannaford?
Yes. All right, CEO's report.
All right. So, if you had looked through the report under nursing, we're excited to have hired Jillian Burton. She is another Northwestern graduate from last May. So she started with us a couple weeks ago. So that brings our total to we had 2 graduates from Northwestern, 1 from Southwestern, 1 from NOC. Gabby Morales that has worked for us for several years. She went from LPN, she got her RN, and is back with us as an RN, so we're excited about that. It's been pretty busy. Surgery numbers are looking really good. People continue to love, of course, Dr. Tupper. His clinics are always jam-packed. And Dr. Guerra is getting busier, and Dr. Roberts is always busy as well. So we're happy about that. And we've got a couple of new employees in housekeeping. We've really been focusing on our registration processes, and I'm excited to report since the 17th, Kelsey reported out today that she's been able to bill everything off cleanly, meaning we've not made any registration errors up front, and that really helps things go much more smoothly. So that's something that we've really been focusing on and working hard on, and that is paying off. Kind of along that note with registration, we met earlier today, and we need to give a shout out to staff and also CodeQuick. You know, we switched from TrueBridge to CodeQuick back mid-June, and we've made more progress with CodeQuick in that short amount of time than we did in the 5 years we were with TrueBridge. So things are going well, knock on wood. We are not getting billing complaints. We were having a little conversation earlier before the meeting started, and some of you commented that you're not hearing complaints. So that's a good sign, and hopefully that'll just continue to improve. We can tell by the cash flow that those payments are coming in quicker, and it does help us be able to take care of our business on this end as well. Anything else you want to add for that?
No, I mean, it really, just to echo what she said, it's really been nice to be able to pay bills whenever they come in, and I'll go over a little bit of that when we get to my report, but they've done a great job. Yeah, I'll go over that. Okay,
very good. Other than that, I have Amanda with me tonight. This is Amanda Schroeder. Amanda has been hired for strategy and growth. She's going to help us take it to the next level. Going out, and I'll let you introduce yourself and kind of tell them a little bit about what you've done and kind of where we're going.
Okay, thank you so much. First of all, I want to say what an honor it is to be in such esteemed company this evening. So thank you so much for allowing me to attend this meeting. I've met some of you already. For those who don't know who I am Amanda Schroeder. My husband is Jesse Schroeder. He teaches at Northwestern in the communication department. We are from the Freedom, Oklahoma area, which is where we currently reside. We had moved from Alva to Texas to kind of kick off Jesse's broadcast journalism career, and moved back a little over 2 years ago to assist Jesse's parents with the farm. And so that's why we selected Freedom, so be closer to them. During that time frame, and actually for the last 5 years, I worked for a medical debt receivables company. It actually was an umbrella company. We oversaw 5 different companies. In a vice president position, I was able to go remote when we moved back to Oklahoma, so that's what I had been doing for the last 5 years. So to have the opportunity to be able to expand upon my service to the healthcare industry and to patients, it has been a dream come true for me. Jesse and I, we became certified EMTs with Freedom EMS at the beginning of the year, and have really been desperately searching for ways that we continue to give back. So to be able to have a positive impact, to bridge gaps, to make inroads and expanding rural healthcare is a real, like I said, dream come true for me. So it was not optional. I said yes, and I'm here. It is going to be challenging, and I know that you all know probably exactly what I'm referring to. Just rural medicine in and of itself, funding is an issue. Being able to get providers, the right providers in the area, being able to get people who are focused on our community members as people, as family members, as friends, versus just dollars walking through the door. So that landscape is going to be challenging. But the good thing is I love a challenge and I don't lose. So I'm very excited and prepared to take that step on. The other thing that I'm working on is just working within the community itself, just making my proper introductions to different entities, groups, and community members. So that's what I've been working on the last 2 weeks. You might hear from me. I know Dr. Hannaford, I am planning to reach out to you and come out and talk to you sometime pretty soon. But just, getting in touch with, just some of those influential community members and groups, and just being a sounding board and just hearing, what is Share doing well, where can we grow, and gathering all of that feedback and those insights in order to, be able to start developing a strategy and moving forward. And so that's been really busy, and it's been really exciting because I've heard some really amazing stories. Of course, myself, I attribute Share was saving my life. Last summer, I was in septic shock, and Share was who provided my initial stabilizing support. And then, of course, Jesse is also a fan of Dr. Tupper, and just had surgery up here 2 weeks ago and had an amazing experience. So I just want to say thank you so much for the opportunity, and I am going to work so hard to do my very best and to continue to get your report where we just are growing and growing. So thank you for the time.
Absolutely. Welcome. We're excited to have you.
Okay. Do I have a motion for the CEO's report?
I move to approve the CEO's report written for October 2025.
Second. Thank you. I have a motion by Dr. Simon, second by Mr. Bowman, to approve and accept the Share Medical Center written report for October 2025. Any other questions? Roll call.
Bowman?
Yes.
Burke?
Yes.
Simon?
Yes.
Brown?
Yes.
Hannaford?
Yes.
Martin?
Yes.
Okay. CFO's report, Kelly.
Okay, bad news first. I'm going to start with, we got our 2025 cost report back. We did have a $517,000 payable this year. And basically what that means is that last year Medicare paid us more than they should have. We saw that kind of at the end of the year. You remember we got a really big, $500 and some thousand check from Medicare, and we didn't really know why we got it. And so basically they had paid that based on previous year volume. And then the current year volume wasn't at that level, so we were overpaid by Medicare. So we will have to make that payment back to Medicare by the end of November. That said, a year ago in October, our total accounts payable was more than what our total accounts payable will be when we double it by adding this payable into our AP. So we're in a great shape to be able to handle that. As Candace mentioned, our billing company's been doing a fantastic job. Our in-house staff have been doing a fantastic job getting clean bills out the door and processing payments. So that has made a tremendous difference in our ability to, like I said, pay our bills and continue moving the organization forward. You can read in the report our cash balance and receivables and all that stuff, which is normal. I will say that we did have an increase in our net operating income. We had $175,000, the best month of the fiscal year. One of the, aside from the months where we received cost report settlement monies, one of the best months we've had all calendar year. And then our net income after sales tax and everything else was $290,720. Year to date, after 3 months, we do still have a $57,000 loss. However, last year at this time we had an $82,000 loss. So that's about a $25,000 improvement over last year. So it's kind of moving in the right directions. Typically July through September are not the best months for the hospital and clinics and whatnot, and so we expect better volumes and financial performance in the months ahead. I talked about I talked about total payables, and that balance for September was $511,000. That was down about $71,000 from August. That's a good number. Our age payables, we have, when you don't consider the invoices that we have made prior arrangements to pay at a later date, we're at less than 0.25% older than 90 days, and then about 68% of our payables are considered current, so not due yet. That was at the end of September. We did renew some CDs. Alva State got one of those for 12 months, and High Plains Bank got the other two for 12 months. Got some pretty favorable rates on those, and so we'll look forward to having that interest income. And that comes from the cash that we got from selling the nursing home, as well as the employee retention credit that we got for the nursing home. We did receive in September our shop payments for what should have normally come in July, and then here in October we've already, probably tomorrow, we'll receive the third of our 3 shop payments for the month of October. So back-to-back months where we're getting shop payments, which is not typical, but that certainly helps with the cash flow when those come in. We did experience just kind of a lull in cash flow at the beginning of October with the federal government shutdown, and they had a subsequent 10-day hold on all Medicare claims. We ended up having to use our line of credit for some of that period, but we anticipate having that paid back here pretty quick. Might have to use it again to make that cost report settlement payment by the end of November, but we've got plenty of room plenty of cash flow to probably not have to borrow that whole amount at all. We did today have at our finance committee meeting, Bank of Oklahoma joined us virtually for presentation on some options for borrowing money to do some capital outlay projects. Primarily, the biggest ticket items are going to be in the HVAC, mechanical realm, so air handler units, control systems, stuff like that for our heating and air. But we also, if you'll remember, we had a really big list of capital budget items when we approved the budget back in June or May, whenever we approved it. So we're looking at probably being able to borrow money to do about $2.5 million worth of projects. Of course, we're going to have to go through the processes that it takes to get those loans approved, not just with the lending institution, but also with the board. So we'll stay tuned. We hope to move pretty quickly on that, though. We'll bring you guys back together for all of that. Other than that, I want to draw your attention to about the very end of the CFO or the finance report before you get to the pages that are in the sleeves. Code Quick, there's about 16 pages here. It looks kind of like a PowerPoint presentation. There's about 16 pages here that kind of go through some of our performance indicators or key performance indicators for the revenue cycle. Page 15 is a good summary of how things are going, but if you look back through the rest of the pages in the report, you'll see that we're at 99.6, I'm not looking at it, but like a 99.6% clean claim rate. So, you know, that's as good as it's ever been here, and it's above, you know, where a KPI would be, you know, for nationwide benchmark. So we're pleased with a lot of the numbers that you'll see in this report. But page 15 does kind of a summary that I think is a good indicator for the board members to look at how we're performing. 5 areas that we're focusing on with this report are net days and AR. You can, if we'll just take that column, the actual metric, so the 36.7 days, that's our actual metric. The key range, they say, is we should be between 30 and 60. If we get to where we're down to 30 or better than 30, then we'll be performing at a very high level. They give us a range of points based on our actual metric as a percentage. That puts us at 77.7%, and then there's a relative weight for each one of these 5 columns. And with that 77.7% at a 21% weight, we get a revenue cycle. We get revenue cycle points, which is that bottom blue line, and I think that says 16.31. Didn't print out very clearly on mine. But you can kind of see what the metrics are in each of those columns. The second column is discharge, bill not sent to the payer yet. So that's the unbilled column. The next column is point of sale cash collection, so that's how much money our staff are collecting when somebody comes to receive their services.
You can see that's our biggest opportunity.
Cash collections, that's total cash collections, how much money we've collected on what's been billed, and then our denial percentage. And you can kind of look through there and see how we're performing. I will say that since we started with Code Quick, we dipped a little bit in August, but in September we had more improvement. That those 3 bar graphs on the right-hand side of the page, the revenue cycle scores for 2025, July, August, September. We were right at 51% in July, dropped down to about 47 in August, but then up to 64.4 in September, with all indications that we're going to see that continue to improve in October. I think if you take some time or pull this out and take it with you if you want to look through this, but you'll see that there's a lot of our numbers that are improving with regard to our revenue cycle, and it really is showing with the cash collections that we've been able to have, and showing what the lack of complaints that we're getting regarding our billing. And I'll also kind of throw out there that as we've gone through some of these changes, we've also tried to get with the times and have more options for people to pay their bills. And so now our patients can use Apple Pay or Google Pay or Venmo in addition to your regular credit card or check writing transactions, stuff like that. So I think all of that is helping. I know it's all helping. The proof's in the pudding.
You know, they're getting a text link, when the billing comes out, you can pay it, via the text link.
We are offering, so I want to make sure everybody understands that with Code Quick, they are doing follow-up phone calls after statements go out. These are not collections calls. These are simply courtesy follow-up phone calls to say, hey, we just want to make sure you got your bill. Is there anything I can help you to make your payment? If you've received 4 statements, that's probably going to be a collection call. But any phone calls you receive up until that 4th statement is going to be just our efforts to try to make sure that we don't have to send anybody to collections.
Okay, any questions for Kelly? Okay, hearing none, we'll move on to Medical Staff Executive Committee. Dr. Burke, anything to report?
Not really. We met October 16th and had no business to bring forward for prevention committee, so
Okay.
not very much.
Any questions for Dr. Burke? We'll move on to coffee, to item 6. Anything you want to talk about there?
Actually, it was a pretty short coffee meeting we have, moved to a super committee format, which brings all of those important meetings to one. So we're all meeting at the table and going over the various issues all at one time. We're all together, and you can see from this report that it did condense things. So we're pleased with that.
Okay.
Nothing in particular.
Any questions for Candace on coffee? Hearing none, we'll move to item 7. Improvement to patient care. Item A, contract review of quality evaluations.
Those
Anything
are
you
all
wanna-
good.
Yep. We'll move to the following items from 7B and 7C are all routine policies and procedures that will be approved or disapproved by one vote, unless any member desires to have a separate vote on any or all of the following items. B, discussion action to approve or disapprove the revisions report dated September 30th, 2025. And C, the approval or disapproval of the corrective action employee success plan and procedure. Do I have a motion?
So moved. Second.
Okay, I have a motion to approve from Dr. Brown and a second by Dr. Simon to approve items 7B through 7C. Any questions? Roll call?
Burke,
Yes.
Simon,
Yes.
Brown,
Yes.
Hannaford,
Yes.
Martin,
Yes.
Bowman.
Yes.
Okay, moving on, share convalescent home report. Kelly?
I think we're about wrapped up with Share Convalescent Home. We did get word that Beatles New Beginnings has their Medicare license in the PACO system. And so while we've been continuing to receive their Medicare payments into our bank account, I expect that in October will either be the last month or September was the last month. But I expect we're wrapping that up to where we won't have any financial activity except a little bit of maintenance we have to maintain our database with the patient records for the period of time that we have to do that. Other than that, that income statement will continue to show some interest on the CDs until we get that asset switched over to the hospital assets on the balance sheets. Any questions regarding that?
So probably by the end of the calendar year, that will be off.
Can
I
you
mean, this
tell
will
me
be
what
off.
our obligation is to Quick Care?
It's 7, or it's,
No, I mean, how long? What are we doing?
we have to,
We have to maintain.
we're still processing some AR in it. I can't tell you how long.
Okay. Let's take a look at that.
Yeah.
Sweet.
Okay. Anything from, next would be the homestead report.
Homestead, if you look year to year, of course, the operation changed a little bit when we sold the nursing home and started processing all of the hospital meals and all of the everything meal program related out of the homestead and set it out at 2 kitchens. That said, the other increase in expenses has been more than the food program increases have been as a percentage of the total. So it's something that we're looking at to try to figure out. We're getting ready to make a recommendation for our annual rate adjustment, and so we're trying to make sure that with that rate adjustment, we're also taking into consideration if we need to change the scope of what services we're providing to something that's more appropriate. But the homestead did have a $12,000 loss in September, and year to date, that's right at almost $41,000. Last year we were in the black. We did have, we did approve an increase in benefits. We did approve that for this fiscal year. So I mean, there's that in there. But utilities are up. Salaries are up from the additional staff. Supplies are up with just inflation with the kitchen. And then you can see the benefit expenses are up year to date as well. But we're going to try to right size, make sure we've got our rates right, and make sure we've got our expenses right too.
Okay. Any questions for Kelly on foundation or the homestead? Okay, Kelly, anything for the foundation?
No, sir.
Say here through the report, we have none tonight. Number 12, City Council report, Mr. Bowman.
Well, all I've really got is Joel Randall was appointed to the Tourism and Convention Development Committee. And we also created a committee, a fact-finding committee for our city manager, who will be myself, Matt Adair, Garrett Law, Sadie Beer, and David Payton. We're opening the application time up till November 15th, and at that point we'll make some decisions.
So you're hoping maybe December 1 or first of the new year? Or?
That would be nice.
Yeah. Any questions for Mr. Bowman? I have nothing on the chairman's reports. Any new business? Okay, I appreciate everybody being here. With that, we are adjourned.